I reversed my mother's type 2 diabetes. This is true. No matter how you look at this problem, she no longer takes medicine or uses insulin. Her blood sugar is very good. Her glycosylated hemoglobin is also very good, and all indicators are good. Perfect. Are you interested? Here is Brother Pen talking about health. Today I will not talk about how to reverse this method. I will only talk about the lies about type 2 diabetes that I, as a doctor, once believed. If a doctor does not know the truth about ordinary people, it is even less likely to care about the truth. So don't worry, this lie will definitely continue to spread, because my voice is too weak for people to believe the truth. If you really understand and spread it, I hope more people will know the truth. Let's talk about the lies that people with type 2 diabetes believe. As a patient with type 2 diabetes, the first thing you hear is that type 2 diabetes is progressive and cannot be cured. No matter what you do, what you eat, you may be able to control it, or improve it a little bit, but you can never reverse it, and it will always be with you. Right? I don't think so. With the right lifestyle and dietary choices, many people can completely reverse type 2 diabetes and have normal glycosylated hemoglobin. However, I need to solemnly inform you that many people are misdiagnosed as type 2 diabetes, but they actually have type 1 diabetes, or adult latent autoimmune diabetes. In this case, there is no way to obtain normal glycated hemoglobin without injecting insulin. However, if you are really a patient with type 2 diabetes, this is a state of constant reinforcement and self-limitation, and you can completely reverse it 100% without exception. The second sentence is that the cause of type 2 diabetes is hereditary, or it is unknown to some extent. In other words, most doctors don't know or don't care what causes it. They just know that you just need to take a few pills and get a blood test every 3 months. Besides, genetics does play a role in type 2 diabetes. Some people are indeed prone to hyperglycemia and hyperinsulinemia, but this is not a curse or destiny. So this is another lie. So what exactly causes type 2 diabetes? Of course, the main one is excess refined carbohydrates, and type 2 diabetes is chronic carbohydrate toxicity syndrome. The third thing is that blood sugar is very important. As long as the blood sugar is not high, we can take oral medications, and we can also control high blood sugar by injecting insulin. Then there is no need to change anything about what you should do, what you should eat, and what you should eat. Really? Have you ever thought about it? You just get more and more medications over time, and hyperglycemia is certainly a significant issue with type 2 diabetes, but more importantly, the hyperinsulinemia behind it, if you don't pay attention to it, is like the stench in the toilet at home, and if you only spray air freshener, of course you are just deceiving your brain. The fourth myth about type 2 diabetes is that you should use medication to control blood sugar and glycated hemoglobin. Doctors now also mention the importance of diet and exercise, but in fact, if your diet is appropriate enough, exercise is not necessary. Imagine if you are a paraplegic or a quadriplegic type 2 diabetic patient. You have no way to exercise, but just through diet, you can still there is a chance to have normal glycated hemoglobin and reverse your type 2 diabetes. The fifth sentence is that patients with type 2 diabetes can eat whatever they want. Diabetics are human beings too. When you wish him a happy birthday, he can eat birthday cake. When you wish him a happy new year, he can also drink. So which one is more important? The current happiness, or the toes, or the retina? Is kidney function more important? Of course, everyone hopes that their body will not malfunction. So if you were a rational type 2 diabetic, would you rather eat birthday cake or have 10 normal toes? The sixth lie is that people with type 2 diabetes should never eat. You should eat something within 2 hours. Eat small meals frequently. Have meals and snacks, so that your blood sugar will be stable. Yes, of course it is. If you are taking insulin, or you are taking a GLY-type drug to increase your insulin levels, of course you have to eat this way, otherwise you will suffer from hypoglycemia. However, once you reduce the carbohydrates in your food, the insulin you inject, and your GLY drugs can be gradually stopped. If you just take a drug like metformin, you'll never get dangerously low blood sugar again. At this time, you can consider eating to help you better control your blood sugar. and restore insulin to normal. The seventh lie is that patients with type 2 diabetes should not eat red meat or egg yolks. For these high-fat and high-cholesterol foods, you should eat grains and fruits. These plant-based diets, I think, are dangerous and the most destructive lies out there. Because of this, it is difficult to have normal blood sugar and glycated hemoglobin, even if you don't eat junk food, eat a plant-based diet, or even a vegan diet. This may improve your inflammation levels. Of course, if you work very hard and achieve a low-carb diet while on a vegan diet, your glycated hemoglobin and blood sugar levels will have a chance to reach normal levels. However, plants cannot provide humans with sufficient protein, fat, and vitamin B12, which may lead to nutritional deficiencies. The eighth lie that patients with type 2 diabetes believe is that as long as your glycosylated hemoglobin is less than 7, it is okay. Although the guidelines say this and doctors say this, it does not mean that complications will not occur, nor does it mean that your body will continue to work normally. Suppose your glycosylated hemoglobin is controlled at 6.9. Your doctor said, "Hey, this indicator is very good, but in fact your average blood sugar level is 8.2. You continue to take medicine, you continue to take injections, you continue to eat your original food, but you are still the same, will face the risk of blindness, kidney dialysis, and premature death. Why? Because normal glycated hemoglobin is 5.6 or lower, and many patients with type 2 diabetes also suffer from anemia. This will make the glycated hemoglobin test result lower than the actual level. What you think is normal turns out to be abnormal, so this will make you ignore the problem even more." Sorry, I said those 8 points were lies, which may have been a bit harsh. However, I would like to say that these are all misunderstandings, and this evaluation should be appropriate. In the end, I have no intention of challenging authority, and I have no intention of challenging professional practitioners. I just hope that fellow patients with type 2 diabetes, you should take responsibility for your own health. As the saying goes, a long-term illness makes a good doctor. You should also try your best to improve yourself. Only by understanding the underlying causes of the disease can we find a way out, and blindly following the disease will only make us sink deeper. Change your lifestyle, change your diet, follow a low-carbohydrate diet and intermittent fasting, control your stress, avoid toxins and maintain intestinal balance, and use your body to feel all these changes. If you find it helpful, you can follow me and subscribe to my channel. Of course, you can also forward it to more people. Finally, let us work hard for health together.